And so like fix that problem first, right? Fix the archaic problems in our healthcare system. Let the medical professionals go back to being what they love doing, which is practicing medicine and patient care, and then start adding things to it. Some of the more challenging areas where maybe it is applied to clinical care. Maybe it is, obviously research and development, it definitely has to be applied to it because no one can ever process that much information. So that's how I was always thinking about it. But in order for that to work, the healthcare system has to really come together and say, these are the three priorities that we're struggling with, that we want the industry to actually focus on.
And now, from San Francisco and the UCSF Rosenman Institute, the Health Technology Podcast with your host, Christine Winoto.
Imagine standing by the bedside of someone you deeply love, feeling overwhelmed by a maze of IV lines, complex medical jargon, and life-changing decisions. Each medication, each choice carries immense uncertainty. For Troy Tazbaz, now Senior Vice President of Corporate Strategy and Operation at Oracle, and formerly Director of Digital Health at the FDA, this overwhelming scene was all too real during his wife's battle with cancer, a profound experience that reshaped his entire perspective on healthcare. Today, Troy carries forward a powerful vision, making healthcare human again digitally. Driven by his deeply personal journey, he transitioned from the corporate technology world into healthcare innovation at the FDA, championing digital solutions designed to simplify medical decisions, enhance patient navigation, and put compassion at the heart of healthcare delivery. In our conversation, Troy candidly shares how his own tragedy became a catalyst for meaningful change. We explore the critical experiences at his wife's bedside that reveal healthcare's deep inefficiency and complexities. Troy discusses his work at the FDA to responsibly integrate digital technologies, emphasizing the need for slowing down to thoughtfully implement impactful innovation. He also reflects on his return to Oracle and offers powerful insights on grief, resilience, and the transformative lessons gained from cycling across America. In this episode, Troy and I discuss the central questions. How can technology restore humanity to healthcare? What does responsible innovation truly involve? And why must healthcare put the patient and caregiver first? Here's our conversation. Welcome, Troy. Thanks for joining me today.
Thank you for having me. It's great to be here.
I'm always curious about people's journey, about how they get excited and interested in healthcare. Your journey is, in a way, is very special and different from majority of people. You were not in healthcare, and then you went to the FDA. So tell us, what got you to where you are today, and now you're no longer in health. You're back in the corporate world as well.
Yeah, my probably journey was slightly different than most people who went into healthcare through probably the more educational vehicles or pathways. And for me, it was, I was working in corporate America. I did a variety of just kind of projects. I was managing several divisions at about 5.5 years ago, my wife was diagnosed with colon cancer. And then, I ended up spending a lot of time in the hospital with her and kind of just observing what was going on as we spent a lot of time in the hospital. And, I started noticing the things that I believe that maybe technology could have improved kind of the process of care, especially to someone, as young as she was. She was 37 years old at that point. And after she passed away, you're dealing with a lot of grief. You're dealing with a lot of emotional ups and downs. Well, not a whole lot of ups, just mostly downs. And so I just kind of made a conscious effort at that point. I said, I got to take a lot of this kind of grief and anger and, but that has a lot of energy to it. And what can I do with it? Right. I mean, and, most people, you have really three options. And, one is directing it towards your community, and that could be very destructive, or you can direct it to yourself, and that's self-destructive, or you can be constructive. And, I'm not saying that it was always easy, but nonetheless, like I had a more of a North Star, and I said, I want to do something with it. And, healthcare is one of those interesting things is that you don't really have to be a deep expert in healthcare to understand where maybe some improvements can be made. And I think healthcare is also an ecosystem, and they're dealing with supply chain, they're dealing with psychology, they're dealing with technology. I mean, they're dealing with so many different things that you want a variety of ideas, a variety of thoughts. And this is the same time that she passed away, unfortunately, about 3 months before the pandemic. And now I'm kind of stuck in this pandemic world, trying to make sense of my world as well. And this is the same time that, I was working at Oracle, and Larry Ellison had a brilliant idea of wanting to build a COVID response system. So effectively a clearinghouse for vaccine distribution. And he donated that to many of the governments around the world. And then, they had an idea like maybe we should go into healthcare. And while they were looking for, a leader and general manager for it, I got tapped to say, hey, can you maybe lead this while we're, looking for what we want to do? And so I started the pathway of looking at kind of the products that we would want to develop. And, we were very interested in electronic health records and just maybe putting a modern spin on it. And so I kind of got into healthcare really through that process. And when Oracle decided to acquire Cerner, I wanted to take some time off because I never really had a chance at that point. It was about 3 years after, about 3 years after my wife had passed away. So I biked across the country. I quit Oracle. I biked across the country. And when I came back, FDA called, and it was very random. They had gotten my name from someone in Silicon Valley, a CEO of a digital health company. And, their point of view was, we wanted someone from a different background who understood technology, who understood executive management, can speak to the industry in a way that the industry wants to hear. And I thought that was just a wonderful opportunity. And I decided that I was going to take that path. And I went in there with no idealisms, but like, here are the 3 things that I'm going to go tackle. And I knew that those were the 3 things that I through a lot of conversations with both the government, but also the industry, I knew they were the right three things to tackle. And so that's what I did for the last, 2 years. And so that was kind of the path that I took.
Yeah. It's sometimes it's interesting how our path take us to, certain life event can take us to, to different place that we never thought it would. And tell us a bit more, because you're saying that when your wife was in a hospital, what are the things that you see that you found that this could be better, and could be done differently? And now that you spend, 2 years, and even with Oracle, working on a healthcare, what are the things that was missing at that time, that why it was not done?
Yeah, there were 2, I would say, events that really made me start thinking about some areas of improvement. One was, at one point, like anyone who's had to deal with either cancer or chronic conditions understands like the amount of drugs that are being used, right? Everything from obviously chemotherapies to side effect management. And at one point she was in ICU, and I looked up the IV tree, and I think there were like 15 to 20 bags hanging, and in that kind of foggy state of mind, you're like, what are all these things doing? And I started kind of wondering about, the drug-to-drug interaction. What are the toxicity issues that she's going to be faced with as she's dealing with both, this horrible disease, and now being injected with so many things. And at one point, this resident came and started hanging another bag, and I just like, what is that for? Like, does she not have enough? And this poor resident was just like, well, she has this side effect, and so we're going to add one more. And I said, before you do that, is her side effects within the range of acceptable range with all of the things that are already on there? And he goes, I don't know. And I said, well, shouldn't you go figure that one out first before you yet put another one? And then, our oncologist came and said, don't hang that bag. Like, and at that point, I was a bit upset about the situation, right? I was upset about the process where I was just like, and it wasn't really towards anyone else. It was just more of a, the system kind of just says, okay, if this happens, do this. But it's impossible for any human being to retain that much information around how all these things are interacting with one another. And I started thinking, this is before obviously generative AI. This is in 2019. I was just like, this is like technology should be doing this stuff. Like we should be feeding this information, and do machine learning to kind of train the models to say, look, I mean, this is what our expected kind of outcome is or response is physiologically to a variety of medicine that that you're taking. So that was one of them where I was going, I don't think humans should have to retain all of that knowledge, right? I don't think they should have to make decisions based on it. And I think it could be very easily solved. It doesn't even need generative AI for that. The second one was around the navigation. And, anyone who's dealt with kind of what I dealt with will appreciate what I'm saying here is that you're not dealing with just a single physician or a medical professional. You're dealing with the oncologist, an ICU doctor, a kidney specialist, a liver specialist, all kinds of different specialists, because that's the field of medicine. And as someone who's, the caregiver, I have to effectively speak to every single one of those individuals. And then I have to synthesize all of that information. And then I have to make decisions based on in a probably not the best like psychological state. And I started kind of thinking about this and reflecting during that time. And I was just like, look, here I am. I was a fairly high up individual in corporate America. So I dealt with very complex problems in the business world. And so I had the training to be able to, deal with complex issues, deal with a lot of data and make decisions quickly based on that. But that was through training, right? Not everyone has that. It wasn't because either my intellect or anything like that. It was just like I was exposed to complex situations. And this is probably the most complex situation you're ever going to have to deal with, right? And at one point I went, I need to see all 8 of you in this room and we're going to work through these problems. That's another area where I think that kind of patient navigation, patient understanding could be solved through technology, right? And so those were the 2 events that really influenced the way I started thinking about technology integration into healthcare. And I took that with me everywhere I went, and even the conversations that I would have, and even whomever it was with the entire ecosystem, whether it was elected officials or the industry itself or regulatory agencies. Like I took those 2 events to really hone in on, how I was going to influence what we have to do.
Mm-hmm. And I think the the navigation, that definitely comes through a lot of in the conversation. I think people understand. And I think I sometimes worry being, if you are sick, I mean, your wife is lucky to have you, but if you're sick, you don't have anybody. And your brain is not fully
Right.
functioning because you're all on those drugs, and you have to manage all that situation. And who is in charge to make all that decision for you? And that's always very worrisome for me,
It
at
is.
least.
And if the situations were reversed, my wife would have done the same thing. She was like this incredibly intellectual, incredibly complex thinker. And I know she would have done the exact same thing, but not everyone has that luxury to
Right.
have a caregiver that, and this is again, not about expertise around any medicine, but it's expertise around getting to the truth of what you have to do from a decision-making perspective. And, I had to apply the same thought process and working through the problems in the most like critical of times, whether it was for her treatment or, maybe we need to not treat anymore. And so,
Mhm.
but that's a, you know, it's an incredibly difficult process to go through.
I think many people who have the luxury or the access to concierge medicine, they have that, right? But majority of people
The majority of
don't
people
have
don't have that.
don't
And,
have that.
if you're thinking about kind of equity in treatment, then that becomes a very important part.
Right. I mean, I recently update my healthcare directive because, as you know, my husband passed away. And for a while, I was having my friend who is a physician to be my healthcare directive person. And now my son is older. And I was like, maybe I should have him. But then he's only 18. That is not old enough to make a lot of that complex decision, as you're saying.
Situation.
They don't have that. You have not had that training, right? So again, everybody, how you mentioned about this is something that technology can maybe help address. What's your thinking when you think about how technology can help address this?
Well, I mean, there's multiple, I guess, pathways to that, right? One is the more of a patient kind of training and education around these issues. And then there's also just being able to synthesize the information of very complex kind of medical problems that you're dealing with. It's a confluence of issues. Cancer is not like a single thing, right? You're dealing with so much, right? You're dealing with the cancer itself, but you're also dealing with all of the organs that are responding to cancer itself. And so, like, there's no way anyone could be a liver, so she had colon cancer, and colon cancer is very common that it spreads to the liver and then that's impacting the kidneys and brain. And now all of a sudden you have to be an expert on every single organ in order to make the right decisions. And, the situations that you're dealing with are like, okay, the liver is failing. A lot of the liquids that are going, that were supposed to flow into the kidney are now flowing into her stomach, her perineum. And now all of a sudden the kidney is not getting enough fluids, and therefore the kidneys are shutting down. I'm like, so that's the situation that you're dealing with, right? And so now all of a sudden you have to make the decisions around, well, should you be treating the kidney at this point, and what else can you, what other options? And you have to make those choices. You have to make the decision, right? Because they're constantly asking you, what would you like to do? And that it was a very complex thing, right? And so, you're not going to be able to train everyone with all of this information. And I certainly did not understand it, right? And so, but the only thing that I understood was like, okay, the process of elimination of what you have to do. And so, I think there's a variety of ways of helping, these patients or caregivers navigate decision making. And sometimes technology could help with that. I don't know what the form factor is. I don't know how that's going to work, but nonetheless, I think it's very important. You said something that I think should be more on the healthcare language is directives, like medical directives. Not everyone has that. Like, I have mine now, but I would have never thought about it until I went to, the experience that I had. And so, the people who are now going to be responsible they're very clear on what I want as a person. And I think that type of literacy should also be taught, about, what do you want for your life? Because there's a difference between extending the life versus extending quality of life.
Right. I think if only we can have more conversation about the end of life, right, and not think of it as such a taboo thing that some people, if you don't talk about it, it would never happen, which we all know. We will always, that's once your thing in life is that you will die.
It does. Right.
It's definitely we just, not many people know when that's going to happen, but it's definitely going to happen. I think changing that culture and having that public discussion more open about it, and hopefully people don't think of it as such a scary thing. Right. I think that would be. So you mentioned about when you were in healthcare, being in FDA, whenever you talk to a government official, the things that you mentioned out of these two areas, that for the 2 years that you were in government, is there things that is done differently I mean, what have do you feel that your 2 years you have accomplished what you want to accomplish?
Um, well, so I never went into it with very specific use cases because, as a government official, you can't promote a
Right.
specific type of product. But the things that I really focused on and my team focused on through both working with the industry, through public-private partnerships, but also through the guidance documents was like life cycle management. And this was an interesting challenge to a regulatory agency that was based on making sure that every product that is coming into the market are safe and effective. But that has always been applied to the pre-market authorization part of that process, that milestone of getting your regulatory approvals. What I started talking about was that when you have now a new medical product, in this case it was generative AI, that is adapting in different environments, then you have to think about safety and effectively differently from just the pre-market, but you have to maintain that as you deploy that into critical environments. And so what we end up promoting was really around the full lifecycle management of artificial intelligence applications. It's not just about how you train the model, but it's about the integration. It's about the management, and it's about the ongoing monitoring. And so we really promoted that level of discipline. And, this was not, in my opinion, very unique. Like we just came up with a great idea. It was more of my background was enterprise software. And so, I used to say, like, you don't deploy enterprise gate software or any software without having monitoring capabilities to it. You have to make sure that it runs as intended. It performs, does not degrade. And so the challenge that we were talking about, or what we were thinking about, is that what if you deploy these models in 20 different hospitals that have 20 different populations that the model was not trained on? How do you ensure that they're performing equally in every location? So to me, this was not necessarily just about the equity, it was about the safety
Mhm.
of these things. And so that was really the point that we highlighted through working with public-private partnerships around standards development, issuing a guidance. It was my last month where we issued a guidance, and that guidance was very well received by the industry because it was a very engineering-centric. It was very much like, look, these are guardrails that innovation has to happen within, which in my opinion, how we should be thinking about this, right? And regardless if it's a regulated product or a not regulated product, you always have to think about this in terms of, how do I ensure that these things operate as intended? And what are the guardrails do I have to implement in that? And you do that in everything, right? You don't build a car and sell a car without having guardrails on it. Aviation, right? And so I kind of took that thought process and why is it any different? Especially applied to a very risky industry like healthcare.
So do you think with that guidance that you worked on, what's your take on the role of AI in healthcare and how that is going to positively impact healthcare, and also potentially there's always unintended consequences?
Oh, of course. Yeah. Yeah. I had a unique I don't know if it was a unique perspective, but it was certainly my perspective. And I spoke differently about it. I never looked at AI as like this. I'm so excited about AI from a capability perspective, from a breakthrough perspective, but I looked at AI as that it challenged the way that we thought about this concept of healthcare delivery. And so from my perspective, it was really around, it's not about AI, it's about, if we have to change the way that we practice medicine, given the fact that we have all of these infrastructure related issues like labor shortage problems, increasing costs of healthcare, and it's on both sides, right? I mean, healthcare systems make very little money, like margins. And so they're dealing with a confluence of issues that are putting a whole lot of stress on their systems as well. Then then you have to reimagine this concept of healthcare delivery. And AI just is yet another enabler to that new way of thinking about this. And I often talked about, the biggest existential problem with healthcare was not necessarily, it was maybe the rising cost, but it was really the labor shortage issues. And so if you don't have anyone who's going to effectively deliver the care, it doesn't matter what tools you have.
Right.
Right. And so, from my point of view, it was really around, let's stop the bleeding between the increase in care requirements given the population makeup and aging population versus the available people who can actually provide this. And so how do you thoughtfully integrate this where people can focus on actually practicing medicine instead of doing a lot of things that are really causing the additional burnout? It's not like when I spoke to a lot of medical professionals, whether it were physicians or nurses, they never really complained about the care aspect of it. They complained about all of the operational burden that they have to go through. And so like fix that problem first, right?
Mm-hmm.
Fix the archaic problems in our healthcare system. Let the medical professionals go back to being what they love doing, which is practicing medicine and patient care. And then start adding things to it. Some of the more challenging areas where maybe it is applied to clinical care. Maybe it is, obviously research and development, it definitely has to be applied to it because no one can ever process that much information. So that's how I was always thinking about that. But in order for that to work, the healthcare system has to really come together and say, these are the three priorities that we're struggling with, that we want the industry to actually focus on, because now it ends up becoming a demand signal to the industry where you have a ton of investments flowing in. And I'm not sure what the value of those investments are and the products that are coming out of that investments. And you can see this from purely some of the failures and successes in digital health technologies.
And you mentioned about that, like who could be the driving force to make this happen? Like these are the three things that you're saying that need to happen. And is that the government's role, or is it more everybody collectively somehow come to an understanding these are the three main things that we need to solve?
I don't think it's the government's role. I think it needs to be the industry putting because the government is not going to be able to represent all of the issues at the hospital systems. But like, in my opinion, you have all of these academic medical centers that have, like UCSF, and who have a combination of both research arm and care delivery arm. And there's just many of them. And I believe that you all should be coming together, like UCSF and some of the other big AMCs and hospital systems coming together and like, this is what we're all struggling with. These are all of the critical issues that every single one of us are dealing with. I think that happens two things, right? I mean, that really puts the focus on the key areas where technology could be applied to that actually will make everyone's lives better, but also it creates an addressable market for the technology sector to say, oh, maybe this is where I need to redirect my investments.
Mm-hmm.
That can only come from the users. So the users have to really effectively be a product manager. The product management function is like, here are the issues that we're dealing with, and we want to address it with a new feature, functionality, or product. Mm-hmm. But I think that needs to come from really the users, the end user.
They definitely are the one who will benefit the most, right? If
I think that it's not hard to kind of imagine where, I heard this often, and it was like, people are coming to me with all of these like product proposals, and like, I don't know what to do with it. I don't know how to integrate this thing into my system. That's another thing that, you have to think about is like, how are you delivering these technologies to the end user? More often than not, I would hear technology, people just were tired of having multiple touch points. They're like, I have to care for the patient, and yet I'm interacting with 5 different interfaces to do my job. And I think that was also causing a tremendous amount of burnout. And so you have to address that.
Right. I think sometimes when you think about that is that, I mean, there's everybody developing their own widget and gadget, and
Right.
then they convince the health system to adopt it. And I think it's also, that's the beauty of capitalists and innovation. Everybody can, and the winners, there's nobody like say, like, if we were to adopt this. And I think like in China, there's only one payment platform versus like here in the US, you have Apple Pay or Google Play. And how do you, it's causing a lot of inefficiency, but it's also creating a lot of good ideas. So
It
how do you
is.
balance that?
Sometimes, market competition really drives innovation and reduction in costs. But there's certain things in it, I believe there has to be market dynamics taking over, and there's certain things that have to be standardized. For an example, like data standardization, right? Interoperability. We've been talking about this for years. I don't know how much money has gone into it, right? And I'm not sure we've fixed anything yet, right? I mean, and so there's been a lot of attempts and initiatives, but the reality is that you have to make this a value proposition than a cost for people to a cost basis that hospital systems just don't want to inquire. So that's an area that you would really, but without data, like even AI is not going to really, provide the value proposition that it's meant to.
Yeah. And I think the data sharing too, everybody.
That's I have my own opinions about that. Um, I used to cite this one statistic that I had read, and it served my purpose, and I never really validated it and said, but there was a World Economic Forum study that went out that something like 97% of healthcare data that was generated never gets touched again. And so we're generating all of this information, yet we don't actually uncover any value out of it. The other thing that was quite telling for me is I wanted to do something in the cancer realm, and I thought about like, well, can we aggregate oncology data to support research and development? And this was years ago, maybe like 2020, that I kind of thought about this idea. And at that point, it was something like 450 gigabytes of data per patient that was being generated, and that's through all of the different modalities of data. And 3 or 4 years later, I was in this at the Aspen Video Festival that was focused on healthcare, and I was speaking on AI, and someone from MD Anderson talked about that oncology data now is at 2 terabytes. And so it quadrupled in 3 to 4 years. And part of it is that because, you're generating more data, you're acquiring more data. And all of a sudden I'm just like, oh, wow. I mean, there's not a single entity that is ever going to want to take on the responsibility of aggregating all that information. So you have to think very differently about this concept of data access and sharing of it. And, when I joined the government, I was just like, look, I mean, don't talk about aggregation. Don't talk about moving things around. You have to figure out how to give access, which means that you have to think through data anonymization and privacy issues. You have to think about access controls. You have to think about, a variety of issues that allows you to kind of remain the data at its generation point, but give access to it for, both research and development, but also things like model training. And so I think that just number is going to probably keep going up. And so you really have to fix the kind of the infrastructure layer of data generation and storage.
I think the problem is not going to get smaller. It's going to get even bigger.
Because storage costs have gone down. So people are like, oh, we have more storage costs. We're just going to retain more data, and we're going to generate.
Like email is free. Everybody's
Right.
sending out email all the time.
Right. We used to delete email. Now no one's deleting email because it just, storage keeps going up. And of course, data retention policies as well that have come in, and especially if it's business email. But nonetheless, it's there are opportunities, but I think what needs to happen is there has to be a consensus driven by the people who are really responsible for all of this stuff and say, okay, these are the 3 things that we're going to go fix. Without that consensus, I think we're just going to keep on doing like healthcare system is a very siloed kind of industry to begin with because of the profession itself, right? You specialize. And I think that ends up influencing how the industry operates. And so I think that there has to be a fundamental change in the way that we have to look at things like longitudinal health, life cycle management of the patient, and start thinking about the patient as a whole, not the individual parts. And I think if we can make that transition, then maybe that's going to influence the way that we think about everything else that supports the value chain of delivering care.
I'm still waiting for that consensus.
I hope it goes. I mean, one of the greatest things about working with the government is the access and being able to have these conversations open and honestly. And I think that people do see it, right? I mean, whether they have their mandate or the budgets or, to kind of tackle it, that's a different story. But nonetheless, I believe that we have to have a true north.
Yeah, I agree. I think that's definitely is important, especially in the healthcare and humanity. I know we're running short on time. I want to ask you a couple more questions. You have the experience now being in the public sector and back in the corporate sector. And there's always a lot of people who come from the corporate, they always think that the government is operating a certain way. Is there something that there's certain things that what you believe it turned out to be true or turned out not to be true when you go to the government sector? Because I think oftentimes people make the assumption right from the outside.
Yeah. There are certain assumptions that I did have. But the one that was more surprising to me is, everyone complains about the slowness of government. And I started actually appreciating why. And part of the problem was I remember shortly after I joined and we were working on, I was trying to bring an agile mindset and execution to the organization. And then I started kind of thinking about this, and it was actually a moment where I was speaking at this conference and someone asked me about why we haven't passed the regulation for generative AI. And this was 4 months after ChatGPT 4 had come out. Like it was so brand new, right? I mean, and I said, well, one is it's brand new. And second of all, you have to be, when you're dealing with something that is as transformative as something like generative AI and the capabilities that it comes with, you have to be thoughtful around how you think about regulation. And in my opinion, it was just more, regulation is just parameters, safety parameters. And being thoughtful requires you to not be reactive. And you have to be and you have to understand that anything that you do impacts 335 million people. That was a moment of awakening for me around, now I see why you have to maybe slow down a little bit. And of course, you can apply that thought process to a lot of things. But from my point of view as a regulator, as a regulator that I was, dealing with guidances, dealing with the law, I wanted to make sure that, you are very thoughtfully implementing this, because the other thing that you have to also think about is undoing it is very different. It's difficult. These guidances are taken by the industry and they're applied to how they think about product development, how do they come about regulations, regulatory strategy, all of that stuff. So you wanted to make sure that you were being really thoughtful about how you go about it. And so that was one of the things that really impacted me around this concept of slowness, because, you think about slowness and you go, it's slow because it's inefficient, but it's slow because you really have to think about all of the considerations that go in, because you have to also think about things like lawsuits and this and that, right? I mean, and so there were a variety of considerations. And so you wanted to make sure that you were also doing things with the industry, like working with the industry closely to say, validating like your thoughts around, we are thinking about these issues. are you also thinking about these issues? So that's what I'll say. I mean, there's a reason for some of the slowness, right? It's
Yeah.
not just because of inefficiencies.
Right. I was talking to somebody who's a trauma surgeon who was talking about how when you're in a very trying to solve difficult problem, is there's a 3-step he said that that you need to remember is slow, smooth, fast.
Yeah.
Just that way you move faster when you slow down. And then you become more thoughtful, intentional, and then become smoother, and then you move faster. I think that
the word intentionality is very important in this one. You had to be very intentional about kind of the guidance documents, the way that you were communicating, that you were writing and publishing, and how you were communicating this thing. The other thing that I'll say is that the people that I end up working with in the government were just so top notch. I mean, they were so thoughtful and so mission driven. And I'll say this: it's incredible. Like, one of the things that I took from there is, like, no matter what the stresses that I was dealing with the ecosystem, dealing with a variety of issues, it was always wonderful to come in and knowing that everyone was there because they truly cared about the mission. They were so mission driven individuals. And the other thing that I'll also say is, like, yeah, there was slowness, but there was a lot of also, like, very aggressive timelines for certain things because you're dealing with so many different issues. And so some of them were very critical in nature, and some of them were, maybe a little bit more that you could be thoughtful about this stuff. And so it wasn't like, you're going in every day and every day was the same.
right.
Every day was different, right? You're dealing with things that are moving so fast, right? Outbreaks. I mean, that's what these regulatory agencies are responsible for, is fixing that. And we saw the best of government operate during COVID, like the organization of how, I mean, there's not a single other institution in the world that could ever do something like that, right? To coordinate the various agencies and military to be able to get these and work with the industry around getting the vaccines, both research and development and produce, and then the distribution of it. I mean, we saw the greatest thing about, like, how organized the government can be. And, I always say this, sometimes government is just fantastic at doing the hard things.
Yeah. Last question about, you said that you went for a bike ride across the country. Through that journey, what did you come back from that journey? What insight that you learned?
I think slowing down a little bit. I think the best
Why
analogy
is it important of slowing down?
Yeah, the best analogy I can give is when you're driving, right? If you're taking the same route and you're driving, but your peripheral vision is the windshield. You see what you see, but you're going by something so fast. When you're on the bike and you look into the distance and you notice something, 20 minutes later, that distance is still there, and you notice something else, and you notice some other beauty to it, something more unique to it. And that was an incredible experience. And I went through this country is absolutely stunning. Like, anyone who's never traveled through this, it's an incredibly gorgeous country with such diverse terrain. And, I saw beauty in so many different things that before I would fly over, and, from 30,000 feet, it doesn't look like anything. And when you're in it, you notice something so unique. And I remember this, I was in Nevada. And Nevada is just this, it's actually quite mountainous. Not a lot of people think about it. They think it's desert, but it's desertous, right? And I looked in the distance, and they had all this gorgeous desert flowers just blooming. And it looked like a beautiful pastel painting. And the thing is, like, I would have never maybe noticed that. I would have never noticed the subtle details about this place that gave its beauty and its how it all worked together, like the environment worked together to create that beauty. And I think that was probably it. It was grief. I will say, for me, it was I no longer saw beauty in the world. It was very impactful to me. And I think that anything that came out of it was being able to see colors and beauty again. I think that was probably the biggest impact it had.
And how is that impacting your life now?
I think it's still, I moved back to San Francisco after living in DC for the job. And, I'm from San Francisco, and I just, I live in an area where I walk outside and I see the Golden Gate Bridge. And, I remember the first time I ever saw that, I was probably like 4 or 5 years old, and looking at it as a late 40s now, and I still have the same feeling that I get from it. And just looking at the Marin headlands in the backdrop, and I think that's probably it. It's just that noticing the subtleties in life is probably is what changed.
It's the little thing in life that makes...
Little things in life. Life is not about the big milestones. It's about the subtle things. Even, that's what I learned about my marriage too. It's the things that were so unique to us.
Yeah, exactly.
Things
Otherwise,
you can appreciate that. It's like no one else. You can't share that with anyone else other than someone who knows you so well.
Right.
And you know them, and the inside jokes, the laughter, and and those are like the day-to-days were the most amazing thing about
your
marriage.
habit, your ritual. That little thing that you take it for granted, and then actually those are the one that matters. So I always say that experience what we experience, then you realize it's not that, then you pay attention to all those details more.
I agree.
Yeah, so,
I think that's what came out of it.
Yeah, well, that's great. Well, thank you for sharing your story. Thank you for sharing your insight.
Well, thank you so much for having me, Christine. It's been a pleasure.
Thank you for tuning into today's episode of the Health Technology Podcast. We hope you found the conversation insightful and inspiring. If you enjoyed this episode, please take a moment to subscribe, rate, and leave a review on your favorite podcast platform. Your feedback helps us continue bringing you the latest in health innovation. Stay connected with us on LinkedIn and Twitter for updates on upcoming episodes and more. Until next time, keep pushing the boundaries of what's possible in healthcare. I'm Christine Minato, and thank you for listening.